Welcome on behalf of BioCanRx and Stem Cell Network to this co-hosted Wellness in Academia, a mental health discussion event. This joint event is part of SCN's Stem Cells from the Sofa series and BioCanRx's Insider series. BioCanRx and SCN support Canadian investigators and trainees as they develop and translate therapeutic discoveries into immune oncology and regenerative medicine fields, respectively. As many of our community members know, participating either as an investigator or a trainee in the fast-paced nature of modern health research has been or can be exhilarating and rewarding. However, it is also clear that an increasing number of researchers are feeling stressed and fatigued as they carry out their roles, and exhaustion and burnout is on the rise as scientists attempt to discover the increasing, attempt to balance the increasing expectations and demands of a highly competitive vocation with their home lives. So at this point, I'm going to hand over to Megan Mahoney, who is the Director of Scientific Affairs and Training Programs at BioCanRx, who will provide a few housekeeping items and then introduce the panel. Megan.
Awesome. Thanks, John. So welcome everyone to panelists and participants. We're really glad to have you in this interactive session today. So in today's session, we will be offering you a chance to ask questions via the Q&A chat box. And in this function, you can also upvote questions that you think are particularly relevant and pertinent to you. And we'll also be using a function called Jamboards, which is effectively a virtual whiteboard where you can add your responses to the various different questions that we'll be adding. So with that being said, all of the interactions will be anonymous. So though we are recording and the webinar will be available later, no one's video is on and you are muted. With that being said, if you'd like to add to Jamboard, and we really do emphasize your interaction in that capacity, we recommend that you ensure that your Google isn't logged in so that your name doesn't show up if that's a concern to you, or you can also open the browser in incognito mode just to ensure that, that your name isn't present there. So with that being said, you can find the speaker bios and resources in the document that's linked via the QR code at the top of this screen. And I'll also be adding it to the chat box as well. So with that being said, I'm really excited to introduce the panel of experts today who will be describing the scale and the scope of mental health challenges that are impacting academics at all levels. So from left to right, we have Jessica Bounassar, who is the Vice President of Member Relations at the Science and Policy Exchange, and also is a Masters of Science candidate at McGill University. We next have Teresa Evans, who is a principal consultant with Tier 1 Performance and is also an assistant professor with the Texas Biomedical Research Institute, followed by Nathan Vanderford, who is an assistant professor of toxicology and cancer biology at the College of Medicine, University of Kentucky. And finally, Judith Laposa, who is a clinician scientist and psychologist with the Mood and Anxiety Division at the Centers of Addiction and Mental Health, CAMH, and also an associate professor at the University of Toronto. So with that, I'll pass it over to our moderator. That's Nathan Vanderford. Thanks.
Thank you very much, Megan. On behalf of the entire panel, I'd like to say thank you to the two organizations for making time and space for this very important conversation. We really look forward to engaging with the audience. And to start out, you already heard our introductions, but we're each going to very briefly go around our virtual panel room here and talk a little bit about our perspective for this very important topic. And I'll start out and I'll say, I think the reason why I'm on this panel is several years ago, Dr. Evans and I set out to do a study on mental health and the graduate trainee population specifically. And we'll both touch on aspects of the study in this brief introduction, but what I'll say is that we started this out because there had been a few studies done and found some very important data. However, the discussion on this topic was not at the level where it should be, and there wasn't a focus. There wasn't things being done to really move the needle on helping the community address the wellness needs of trainees and faculty and staff and everyone in the entire community. So we set out to try to elevate the conversation. And so we did that. We surveyed around 2,000 participants, and and these were across multiple countries, many different institutions, several different disciplines. And what we found was what we described as pretty significant levels of anxiety and depression. We found about 40% of our participants had moderate to severe levels of anxiety and depression. And so that led us to title our paper that was published in Nature Biotechnology as evidence for a mental health crisis in graduate education. We found that non-male participants had the highest levels of anxiety and depression, and a couple other things as well that Dr. Evans will touch on. But I think that this speaks to the need to further address these very important topics. And we're excited today to be here to talk about this and talk about issues that we're facing and how to address those. So I'll pass the mic now on to Dr. Evans.
Hello, everyone. And I second Nathan's comments about thanking you for being here today and thanking you for this opportunity and thanking BioCanRx. We are honored to be a part of this ongoing conversation that, is something that really does need to stay at the forefront of training in academia and the life sciences and the like. As Nathan described, our study found several things, and particular of relevance for our discussion today. There was an association between one's perceived work-life balance, or whether they had that or not, and their levels of anxiety and depression, as well as the mentoring relationship that one had and how positive or negative that was perceived in one's mental health or wellness. And we'll talk about that as a panel today, both of those topics, as well as any other topic you'd like to discuss. But I think it's really a unique opportunity to be a part of this panel where each of us bring to light unique perspectives on those two particular topics. And I wanted to share a little bit about my background as well. So I am a neuroscientist by training, basic science, bench research, spent time in a department where anxiety and depression research was at the forefront of what we did on a regular basis. But there was very little discussion about those topics within our own halls, our own laboratories and classrooms. And it was that really prompted discussions with my colleague Nathan about, is this something that's not discussed at your institution, or do we really need to continue this conversation and to put some, fire underneath the conversation? And here we are today. So thank you all for being here. And with that, I will pass it over to my colleague Jessica as well.
Hello, everyone, and thank you again, Megan, for the introduction. I'm really glad to be here discussing a topic that is very important to me personally, since I'm still a graduate student, and I'm pretty sure it's very important to most HQPs and graduate students as well. So I'm here today because as part of Science and Policy Exchange, which is a student-led organization that aims to bridge the gap between research and decision-making, I have worked on a project that aims to develop recommendations to improve mental health in academic institutions in Quebec. So in our project, we collected qualitative data from 26 participants. Most of them were graduate students. So we gathered that accessibility to resources and services, student-supervisor relationships, the stigma around mental health, especially in academia, and the incorporation of equity, diversity, and inclusion while addressing mental health problems are areas that need so much work. So our recommendations mainly targeted mental health specialists, principal investigators and supervisors, advocacy groups, academic institutions, funding agencies, and the government. And they revolved around improving accessibility, making resources inclusive, and improving how supervisors deal with mental health issues and nurture a healthy environment in the lab. So the primary motivations to start the project were actually two. The first one is that as the previous panelists also mentioned, mental health problems in academia are very prevalent. And I always like to refer to the results of the 2016 National College Health Assessment that reported that 44% of post-secondary Canadians felt so depressed it was difficult to function, and 64% felt overwhelming anxiety. Yet this topic is still stigmatized, and especially in academia and in labs. So being part of the discussion and shedding the light on the problem could help really destigmatize it. And the second point is that there is a need to focus on equity, diversity, and inclusion when thinking about mental health in academia, which would allow the creation of different forms of targeted support. And when I talk about targeted support, I mean resources and services that are tailored to address the different needs and challenges faced by different groups. Groups that might need targeted support are students who identify as Black, Indigenous, or people of color, or BIPOC, students with different abilities, individuals who identify as 2S LGBTQIA+, first-generation students, and students with dependents, and of course, international students. With that, I would like to end my notes and pass to Judith.
Thanks, Jessica. Hi, everybody. I'm Judith. I'm a psychologist and clinician scientist at CAMH. I have probably two main hats. My first hat is clinical and teaching, and that's about 80% of my time. So seeing clients for assessment, treatment, teaching residents, supervising residents, things like that. I oversee the psychotherapy programming here at the hospital for adults that have mood and anxiety disorder related difficulties. We are also spearheaded an initiative last March around mental health initiative for healthcare workers whose mental health was negatively impacted by COVID. So that's been running for about a year now, and it's been a really interesting experience to live the pandemic, you know, as a kind of an average person in the population, and also be working with highly trained healthcare professionals who are kind of putting their hand up and saying, this is really super hard and I need some help to get through it. So I've been overseeing that initiative for the past year or so of having government funded assistance for healthcare workers to get very rapid access to treatment. So a lot of my work is around kind of clinical issues, but I'm also wearing an academic hat doing research for about 20% of my time. My research is around mood and anxiety disorders. I recently went through the senior promotions process at the University of Toronto, which, as you all know, is an involved process for academia. So I had my promotion go through last summer. In terms of kind of life with the pandemic, I also have school-age kids at home and partner teacher at home. So, you know, similar to everyone else here, trying to manage kind of all those different hats and having your research stop because of the pandemic and being under stay-at-home orders and you can't do the stuff in the lab, all that type of stuff. So I'm really excited to be here and talk to everyone around mental health and wellness.
Okay, thank you, panelists. So if you're joined us a little past the initial introduction, or for those of you who are on even then, this is going to be a highly interactive webinar, and we're going to start that out now with our first panel, with our first poll question, which we will use to help, I think, initiate some additional conversation around this topic. So you see the first two poll questions here. Has your mental wellness changed since you've entered academia? And then follow up to that, has your mental wellness changed since the start of the COVID-19 pandemic? So please take a moment, answer both of those questions. And then when the responses slow a bit, I will end the poll and we will discuss those just a bit as a panel. All right, still responses coming in. Okay, I think these results are not going to be too shocking, I think. Give it another 10 seconds if you can respond. All right, it looks like the majority of you have shared your responses, and here are the results. So it looks like, has your mental wellness changed since entering academia? 61% say it has declined, 35% say it's stayed the same, and a minority percentage says it's improved, and very similar results to, has your mental wellness changed since the pandemic? So panelists, do any of you have any responses to this?
So I have to be honest with myself and say I had a little peer pressure on these questions. I wanted to say that my wellness actually improved a bit since COVID, but it's a little hard to distinguish. And I think there is some, pressure around being able to say that, being able to accept the fact that in light of the really tough times that COVID has brought, that there have been some positive outcomes. And some of that, I will say personally for me, have been the opportunity to, spend more time with family, to kind of focus more inward when I at times can focus often outward. So anyways, I wanted to share that. I noticed no one else clicked improved. And so I think it's important for us to think about that there are some positive outcomes as well.
And I think I'll stop sharing these results now. But I think that this feeds into our first Jamboard activity as well, where we're going to discuss what's contributed to your wellness, what has contributed to your wellness change, either COVID or otherwise related. So could we move into that Jamboard? All right, so you see in the chat link for the Jamboard. So please, if everyone can click on that and go over. The way you work this, if you haven't used it before, is there's a little sticky yellow note on the left-hand side. You can just click on that and add your comment. So what has contributed to your wellness, COVID or otherwise related? And I'll lead out. So on the positive side, I'll say, as Teresa just mentioned, family has been a huge blessing over this time period. I mean, I have definitely gotten to spend significantly more time with my family, and I have two younger kids, 10 and 7. So it's been really a huge blessing to spend all this time with them. On the negative side, I would say work-life balance has been a huge struggle during this time period. Day and night all runs together. And so, it's hard to know when work starts and work stops, and when life starts and stops, especially with 2 kids at home. So that's been a challenge. All right, we're having some good responses come in. It's fun to always watch these populate in real time. I see one interesting comment here, the Groundhog Day existence. I totally feel the same way about that. It seems like every day is the same at home. I'm actually came into the office today, but otherwise would be at home, and it just all feels the same for sure.
I think for myself, certainly in the first few months of the pandemic, the negative change was my stress level really going significantly higher. It seemed like as many parts of the world were ramping down, healthcare was ramping up, and we were sprinting, ramping up. And I found that very challenging. But one of the positive things that came out of that for me was re-engaging with mindfulness practice, feeling like, how am I going to manage this level of stress at this intensity? I've got to be doing something differently. And so I started doing mindfulness more regularly, which has been helpful for me. So that certainly has been a positive change, that I've incorporated that more in my life. And certainly I would echo Nathan's comments around, not having that commuting time has really led to some more precious time with my kids.
Yeah, this at one point here, we were having more positives than negatives. Negatives are starting to outpace a little bit, but I'm super glad to see that, because I think, speaking to some of the comments that Teresa made, I think many of us, including me, can feel some guilt around anything positive coming from this, because it is such an awful situation. But as we have talked about, and as you all are illustrating nicely here, there's many positives that can come from this. And but obviously many negatives as well that are significant, and I think will have long lasting effects. Oh, the board disappeared.
Yeah, this is Megan's. I'm not sure what just happened. It did indeed disappear.
Okay.
Maybe move on. I'll try to fix it on the back end.
Okay. Well, do any of the other panelists have anything else to say about any of the responses that came in, or in general?
I think they showed a really representative and broad-based like snapshot of all the different ways of life. As I was reading them over, there are so many different aspects of life that have been impacted, both with the positive change as in the negative change. So it's interesting to see that breadth.
Yeah, and my comment would be, and I unfortunately didn't get to read as many of them because I was typing more in as they, but I do spend some headspace thinking about on the positive side as things start to trickle back to potentially the way they were before, or at least where now I had saved so much time just not commuting places. But that time will likely be taken up again. How do we still keep those positive aspects? Like you had mentioned, Judith, going back to your mindfulness, practice. How do we keep that to maintain that as our work life or our daily life shifts back again?
Yeah, and quickly before we move on, I'll echo the commute time. I mean, I came into work today for this, and I had class and other things, but we save so much time by just being able to basically roll out of bed, get ready, and start work versus commuting. I mean, it's amazing. And, I never really thought about this as much before COVID, but definitely do now. And I cherish the saved time for sure. All right, just a reminder to participants, we are ready, willing, and able to at least attempt to address any of your questions that you have. So please put any in the Q&A box, and we will get to those. We can take a few of those in just a moment. So if you want to go ahead and type in any, we'll get to them. Before that, though, we're going to have a brief discussion among the panelists, starting with this question. So what have you seen as the biggest impact of COVID? And Jessica, as a current graduate student, we'll start the discussion with you.
Yeah, sure. So as a current graduate student, and of course, as the results of the report that we did as part of SPE showed, the impacts of COVID that were mentioned by students and that I am experiencing too, and many of fellow students are experiencing, are very similar to the ones that were on the board. So the first one, which has been really mentioned a lot of times, is that reinforcing relationship between unproductivity and anxiety and stress. So students described the feelings associated with COVID as, they were overwhelmed with emotions, and these overwhelming emotions caused them to be more unproductive, and this unproductivity led them to feel more guilt, and that guilt led them to be more stressed and anxious, and that's a vicious cycle right there. The second point was that working from home left many students struggling. So some students were sharing spaces with roommates, and for some it was work from home, but for others it was just work from room. And as we know, a very healthy way to have a work-life balance is to separate the workspace from life space, and this was not really possible for everyone. Other students found themselves with no accountability, especially those who do not have regular checkups with their supervisors or do not have this close relationship with their supervisors. And of course, some academics were caregivers, they had dependents, so that was a struggle too. And finally, uncertainty was a big discussion. Information was always changing, especially about lab closures. Some students had time-sensitive experiments, which you might imagine that could be super stressful. Uncertainties about future employment, and for sure financial uncertainties. Some students had time-sensitive funding or part-time jobs that were lost due to lockdown. So in brief, these were all the negative impacts. There were few positive responses. I might say the positive ones were that people had more time to wake up in the morning, to do some physical activity, to practice meditation. So yeah.
Okay, thank you. And I think your comments nicely correlate with the questions that we just got in the Q&A. So well, let's touch on these two. I'm not sure if everybody can see these, but the first question is, how do you approach academic advisors who are not sensitive to hardships related to the pandemic? For instance, traveling to campus, publication rates, lack of funding. Anyone want to address that?
So I'm happy to jump in, but I think I'll answer the question in two different ways, because, I think dealing with or establishing a relationship with your academic advisor that has clear expectations for communication and ongoing communication aligns a bit with what we just heard from Jessica, that often those expectations aren't in place from the beginning. And then something like COVID or pandemic happens and you have questions like the one that's posed here. And it's a hard hill to climb because that communication has not been already established. So I recognize that. And I find that if that's a place that you're in, that starting there before you tackle some of these questions is most important. So establishing that relationship where you have ongoing points for communication and open communication, whether that be reaching to your mentor and asking for a regular meeting at whatever cadence is most aligns well with both of your calendars, but doing that. Assuming that you have that open conversation in place, then I do think it's acceptable to start to share the concerns that are being faced, not only by you, but then also open the conversation to hear what pressures are being faced also by your mentor. I mean, hopefully that the conversation can get there. I know I'm not answering this question directly because there are so many nuances to these mentor-mentee relationships that are very hard to address with a general response. And so that would be my final closing remark, which is to recognize that there is no one-size-fits-all mentee, mentor, advisor, advisee relationship. We're all humans. And these are all very complex relationships and the relationships that need to be worked on just like any other. So step one, reach out and encourage opportunities for discussion of these topics and others. And I don't know if my other panelists can add to that or expand.
I think that communication piece is so important. Particularly during COVID, I personally haven't met anyone whose life hasn't been touched or compromised in some way, right? So being able to connect around mutual ways of impact, trying to understand their perspective of why they're not being understanding, because maybe there is a lens that they're viewing it through where they're actually trying to protect you in some way by putting these demands that you need to understand and then negotiate a better arrangement of how to both be moving towards a shared goal. But I agree that that communication is really important. And I would hope that in the institutions that you're in, there's also from leadership some speaking around the fact that, like, we understand that everyone is under a variety of different types of pressures with all these stay-at-home orders and lockdowns, et cetera. So I would really hope that your institutions are also having some leadership that is speaking to that you can then point to when you're talking to your supervisor.
I would just like to echo what Judith mentioned. So I was thinking that maybe my answer to that question would be a bit controversial, but I think that yes, of course, communication is important, and bottom-up action is important, but sometimes it takes some top-down action from the academic institution itself to actually prioritize these channels of communication and prioritize students' mental health and well-being in these times. And I think a way for students to actually push for these, these actions from academic institutions is to get involved in, advocacy and advocating for mental health in academia.
Yeah, I think this was a good discussion. And a participant put in the chat, the point of being careful to separate supervisor from mentor, because they're not always one and the same. However, at least in the United States, the way our system is set up, a lot of times when we refer to a mentor, it is the research supervisor. But I totally understand and agree that you can have mentors that are not your direct supervisor. And this is important because, as the participant points out, you sometimes may not want to have some of these conversations with a supervisor and be very direct with that person when they're going to be the person who signs off on your degree or writes you letters of recommendation, those kinds of things. So I agree with that. Any panelists have any comments on that?
I completely agree with that. And I want to underscore the comment about having multiple mentors. Having one laboratory supervisor, if you will, but really building a personal board of directors, if you will. So folks that are varieties of walks of life that provide you guidance as you traverse your career and your life journey. Very, very important. And those individuals are absolutely individuals that you can reach to help with these conversations as well.
Yeah, okay, we have one more question I'm going to skip to before we talk about work-life balance a little bit more, which will address another participant question, which nicely feeds into the Jamboard we're going to do. So one participant writes, how do you separate challenges from, so challenges that feed into mood, let me just read it. So how do you think we as graduate students can attempt to move away from associating results from mood? So like getting good data or getting bad data and how that affects your mood, or, publications that might get rejected. Is there a way to cope with those things and not have them so negatively affect mood?
I think the first thing I would be looking at is the thoughts that are associated with the results that you were seeing. So for example, someone might see no results when they're hoping for significance and frame that in their mind as I'm a failure, as opposed to this study has a null result and it's not a personal reflection on me, for example. So one of the first things I would be looking at is what types of thoughts come to mind for you when you're looking at the results, and to what extent you're kind of personalizing or generalizing. And also to normalize that, when we're running studies, we're excited and we have hypotheses and we want it to turn out. And it's normal to be disappointed if it doesn't go the way you're hoping, especially when there are higher ticket items that are associated with some of those results. But how we're thinking about those results is also important to look at.
I also think that this is sort of tied to the definition of research excellence and the idea that there are, good results and bad results. So I think that maybe redefining this or rethinking research excellence could help in that matter.
And I think sometimes that changes with the stage of the career that you're in, right? So as a graduate student, if you've done a study well, that's often the benchmark that you're being evaluated on, not whether the results are significant or not, right? So I think that can also come into play sometimes in how we view it.
All right. For the sake of time, we're gonna move forward with our next Jamboard, which nicely feeds into a participant question. So the participant's question was, do you have some helpful tips on how to create some barriers between work and life to achieve better balance while at home? So to answer that, we're gonna answer it sort of as a group through our next Jamboard. So click on the Jamboard again. And the question is, what tips and tricks do you use to cope with work and or life stress? So let's answer that with also this participant's question in mind as well, in terms of, what barriers can you put in, or what can you put into place to keep work and life separate to have a better balance? So for me, it's very difficult. What I have been doing is, particularly in the mornings when my kids are very busy with school, I've tried very hard to stay available for them in the morning times when they need some assistance for whatever else. And then I help with lunch. And then after lunchtime is when I get the majority of my work done. And typically I'll work until off and on, but until about 7 or 8 in the evening after that. Just trying to compartmentalize what I need to do with life versus work.
One of the things that's been helpful for me is around trying to keep a routine. So even though I'm working from home, there are set hours that are kind of work hours, when I'm taking breaks, what I'm doing before and after work as transitions. That routine has been helpful in setting some boundaries about when you're at work versus at home. And to the extent possible, being able to have kind of clean and consistent breaks between the two, but also allowing for that flexibility of the things that happen that you can't control. So kids running into the room, or your dog's barking and you have to deal with it, or whatever that is.
Yeah, there's some really good things on the Jamboard. Being okay saying no. I think many of us struggle with saying no, including me. But I have tried very hard over this time to say no more, because we can get overloaded. In terms of boundaries, as was just discussed, closing your laptop, turning off email in the evenings, I think that's good. What else do we have here? Having a personal board of directors, that's great. Take actual full days off. Yeah, I think many of us have struggled to actually take days off during the pandemic. Seeing therapists, that's great comment. Any other thoughts from panelists about things coming in?
I think the exercise piece is really important. So I'm glad to see some on the board there. So we know that aerobic exercise gives the same effects as antidepressant medications for mild to moderate levels of depression. So you're certainly not going to run yourself out of a depression if that's what you're experiencing, but there's certainly quite significant mental health benefits for both anxiety and low mood, in addition to their physical health from getting outside. There's also some emerging research looking at what people are calling as green exercise. So when you're exercising, purposely doing that in natural environments, there tends to be some additive benefit, both for a sense of well-being and sleep.
So Judith, while you're on that subject, what are some other healthy coping strategies?
Sure. Yeah, I'm just noticing where we are on time. I think I will focus my answer on that, less around kind of the general things and talk a bit more COVID specific. So there was a recent meta-analysis that looked at about 70 studies from 19 countries, and they were finding that 1 in 3 adults was having psychological distress as a result of the pandemic. And one of the factors that was significantly related to depression and anxiety was longer media exposure. So, understandably, COVID is a lead story for most news outlets and social media, certainly in the beginning, every single day, like entire papers. That's what you're seeing. And some of these reports are accurate, but others may have kind of little to do with reality. And when our attention is drawn to something, we're more likely to focus on it and to continue thinking about it. So as we think about and focus more on COVID, the perception of threat increases, but importantly, our actual risk doesn't. Just our perception of the risk increases. So by limiting or eliminating contact with media, you can actually help manage your own anxiety and worry. If you can't eliminate contact with social media, then you want to control it. So suggestions would be to make sure that your information is only coming from reputable sources, to commit to only checking a couple times a day, to set regular times when you're checking the news every day. So to standardize those times will help you to both check less as well as reduce fighting yourself around the impulse to check. Some people have tried disabling news alerts on their phone so that those aren't kind of constantly interrupting them. Others have asked friends and family to give them major updates so that they don't have to do frequent checking of media. And then other people have found it helpful to do more of a positive events log related to social media. So examples of where you're seeing reports around altruism or cooperation or positive coping, resilience, those types of things.
All right, thank you. So, and for the sake of time, why don't we move to the next Jamboard, because it really is very important in this discussion. So how do we sustain these coping strategies? Particularly in the situation we're in, and as we think about coming out. So if we've developed some good ones, like getting more exercise or maybe getting more sleep, how do we sustain that? So if participants can think of that, put in your own strategies, your own thoughts for how you will manage this situation when we start to move out of COVID. Integrate time for these activities into your calendar.
So certainly that accountability piece is often a helpful strategy. So making a commitment to do something, verbalizing that commitment. If there are activities that you can do with other people. So for example, you've started exercising more, that you don't have this commute time. Is that something that you can do with someone else? So there's a regular schedule of that happening. You're less likely to not do it. So certainly one of the post-its that I was seeing was around accountability, and that can certainly help.
So Jessica, as a current graduate student, do you have any thoughts on sustaining coping strategies?
I think that this is one of the hardest things to do, but accountability is really relevant to me. So lately I started using this application that made me feel accountable. When studying, you just get another person studying on the other end, and then you both are accountable for each other's time. And also for working out, because I like to sustain that routine. I also contacted a friend to stay accountable for my workout routine. So yeah, I think that accountability is my strategy.
I like the idea of identifying rewards for maintaining an activity. And one of the things that I was reflecting on it when I read that one was around the rewards for yourself, but also the rewards for others. So for example, I was mentioning earlier that I've started doing mindfulness practice more regularly. I found on the days that I skip it, I get much more cranky and irritable with everyone else in my family. So it's an easy pitch of like, yes, I'm doing this for me, but also you need to give me the time to do this because then I'm not going to snap at you later in the day. So sometimes also kind of framing things in terms of how it's also going to help other people around you can sometimes free up some of the time that you need to do some of these healthy strategies.
Yeah. All right. Again, in the sake of time, there's a few more questions that we want to get to for sure. We'll have a few more minutes to take participant questions if you have any more. So be putting those in the Q&A, please. But let's move on. And Jessica, Judith, if you can comment on what are the contributing factors that we're seeing related to wellness, maybe specifically related to academia and our current situation or not?
Okay, I'm gonna go ahead and start. So basically, of the most of the main contributors are, especially when there's a lack of support from the graduate supervisor, the transition from undergraduate to graduate studies can be really overwhelming. The pressure to publish, in both quality and quantity, having imposter syndrome, unhealthy competitiveness in the lab between students, that really prevents students from working as a team and from having a healthy lab community, and uncertainty and failure of experiments. So many of the points that have been mentioned can be improved with a good student-supervisor relationship and by the supervisor providing a healthy or nurturing a healthy lab culture. So I think that graduate supervisors play a very important role in ensuring wellness in academia. But graduate students often reported that they were unlikely to communicate their concerns, their mental health concerns, with their supervisors, because, for example, some supervisors might associate this with a lack of productivity, and this would give students some more negative feelings. But therefore, I think that the student-supervisor relationship is one of the main axes of intervention when addressing mental health in academia. So I don't know, Judith, if you have anything to add to that.
I think those are all really important points. I was also thinking about the notion of identity and how we define our identities, and whether we are defining ourselves very narrowly as an academic and not other things. And I think that's sometimes where we can get into trouble if we have all our eggs in one basket of this defines who I am, because if something goes wrong there, you're kind of in trouble if you don't have a bit more kind of diversity and spread outness. On the individual level, one of the things that tends to happen for all of us is when we're feeling down, we start withdrawing and we stop doing activities that used to make us feel good. And that can often kind of perpetuate the difficulties that we're having, even though it's a very natural response to do that. So when we look at activities that have kind of the biggest mood boosts, these tend to be activities that bring us a sense of pleasure, bring us a sense of accomplishment, lead us to approaching life's challenges and are connected to what we value the most. So in terms of managing being academic, I think it's also really important that we're managing being more than academic, and that we're not losing sight of those other aspects that are really important to cultivate in our lives.
Yeah. Teresa, you have any thoughts on this?
Yeah, whether you're already, there might be some folks who are already supervisors on this panel discussion or in this panel discussion, but there are likely, graduate trainees who will also become a supervisor in the future. And so with that in mind, I often speak to leaders of various groups about how important it is to understand how our behaviors can affect the individuals in our team, and ultimately how it's our responsibility to help create a trustworthy, a trusting environment. And when we don't do that, from a neuroscientific perspective, right, our brain goes into a fight or flight response. And really that fast, fight or flight response overtakes our executive brain abilities, our abilities to think more rationally. And that's not what we want in our team members. That's not where we want to be as individuals either. And so if we can learn to recognize that, if we can learn to recognize the behaviors associated with ourselves and with our team members when they are in a place of fear, then we can also hopefully learn to overcome that. Learn to overcome as an individual by being kind to ourselves and recognizing that's where we are, and working to get to that rational thought, that place of rational thought. Or as a leader, looking internally and saying, what changes in my behavior can I do to help create an environment where my team feels more in control and trust that they can communicate with me and that they don't need to be in that place. So there really is a science behind our behavior in this regard. And I think as researchers, we can all connect with that and hopefully spend some time after this panel discussion researching that some more. There's some great literature out there that talks about, from a leadership perspective, how one can cultivate really strong teams through creating an accountable, trustworthy environment.
Yeah, well, that's really good advice. Okay, so as the panel here, we have about 6 minutes left, and we have 2 questions I want to get to. So let's try to keep our comments crisp to finish up here on these 2 important questions. First is, what does equitable support mean? How do we ensure that we're providing equitable support to members of minority groups?
Okay, I'll answer that. So basically, we need to know that different students have different realities and they face different challenges. So marginalized populations are more likely to experience psychological distress than the general student population. Therefore, these groups should be met with tailored support that can accommodate these special needs. So what happens to marginalized groups when equity, diversity, and inclusion are not considered in designing mental health services and resources? Actually, one of the biggest problems is that Black, Indigenous, and people of color, students who identify as BIPOC, might face discrimination by mental health professionals or supervisors when seeking help. So this is often due to the lack of specific cultural awareness and EDI training. And this really exacerbates the problems that BIPOC students are already going through. So potential solutions at the institutional level would be to recruit mental health professionals who identify as BIPOC that would be able to understand and relate to the realities that the student is going through, and provide up-to-date training to all mental health specialists on the realities and challenges that are faced by BIPOC students. And of course, this also goes to, this recommendation also goes to supervisors. It's good if they would engage in training about equity, diversity, and inclusion, and learn about the realities that the student is going through. You know, just like stay up to date with the news, renew your training to better understand and communicate with your BIPOC students, especially when it comes to mental health problems. Students who most likely need targeted support, as I mentioned before, but I'm going to reiterate because that's really important, are students who identify as BIPOC, students who have different abilities, have dependents, identify as 2S LGBTQIA+, first generation student, and international students. So I don't know if anyone has any comment on that.
Judith, Teresa, 1 minute comment.
I just agree fully.
All right, Judith, anything?
Yeah, and I think that's a great summary. I mean, that's a really big topic, but I think that's an excellent summary. Thank you, Jessica.
Yeah, I completely agree. I think we need to really realize that not all groups are created the same. I mean, we all really need individual support because none of us are the same. And so, but if you think about, different groups of people, we certainly have to make sure that we're making sure to support the groups appropriately. So we have just a few minutes left, and this last question I think is very, very important. So we're going to save a few extra seconds to touch on it. So we've touched on, you know, different aspects of wellness and mental well-being. So when should we seek help? When do we know, or when should we know that we need help? And you know, how do we seek it? Where do we go? Who do we talk to? Judith, you want to lead us off here?
Sure. So, you know, I think many of us have our own kind of an internal gauge of when I'm coping okay versus not. So paying attention to that in terms of one of the things that I would be thinking about is around whether the challenges that you're having are interfering in your life. So if they're interfering with your relationships, if they're interfering with the types of work you want to be doing, etc. And I think oftentimes it's to your benefit to kind of put your hand up and say, I need some assistance sooner rather than later. If we can nip things in the bud, that often is really helpful. There's a variety of different places where you can seek support. Many university or college settings will have counseling services. There are certainly a variety of hospital-based programs throughout the country that are available. For those of you that live in Ontario, the government has funded just recently, in light of the pandemic and its impacts on mental health, has funded internet-based CBT that's free. And certainly I can send Megan resources around that. So if you live in Ontario, that's something accessible that's government funded through the province. But I think being an educated consumer is also really important. So thinking about kind of what best practices are for the type of challenges that you're having, and looking for evidence-based services for the types of help that you need. But certainly talking to friends, to peers, to your mentor, if that's something that you think would be appropriate within your relationship. Oftentimes we're not aware of the extent of resources that are available to us that can range anything from self-help books through, you know, seeing a therapist frequently to help you. But, you know, I think the bottom line is there are very effective treatments for dealing with stress, anxiety, low mood, all those types of things, as well as, you know, strategies for enhancing wellness when you're feeling well and maintaining wellness. So there's certainly a breadth of things that are available.
Yeah, I agree. The more we destigmatize this is going to be helpful too. The more we talk about, you know, getting help, which is very, you know, very beneficial. I see a therapist and it's very, very therapeutic. I mean, I tell you, it's night and day between not, you know, doing it and not. So any other panelists in the next 15 seconds have any comments on this? And we'll turn it back over to Megan and John.
I would just add one quick comment, again, putting the hat of supervisor on, or faculty member or academic leader. I would just ask that those folks, you know, educate yourself about what is out there and what is available for the students or trainees that you work with. As someone who transitioned from graduate school into a role where I worked with a lot of various trainees, that was one of the first things I did, is to understand what are the tools in the toolbox and where can I point individuals to for their support. That information isn't always easily and readily available for you or for your students or postdocs or even staff at that matter, because each individual group often has different resources that they can access. So I just encourage everyone to do some research on what those things are. It's best to have them at your fingertips before you need the resources.
Yeah, I would totally agree. And also as supervisors, checking in with the people that you're supervising. How are you doing? Is there anything I could be doing to help? Those are really important questions to ask and to be offering.
Yeah, that's a great point. Okay, unfortunately, we're out of time. Megan is back, kicking us out of the panel. So it's been a really great discussion. Thanks to all the participants for participating. And Megan, I'll turn it back to you.
Perfect. Thank you, Nathan, and thank you to the rest of you. I think that was an exceptionally well and comprehensively done discussion. And thanks to the participants for filling out your feedback in the Jamboard. So with that being said, we will be disseminating these resources to the community at large for those who registered, who attended, and who didn't attend. We also did record this session. So if you do know of anyone who you think would benefit from this, of course, please do share it. That will be posted on YouTube, and we'll provide information on that as well. And then finally, if you could just please fill out the survey. You guys probably hear it all the time, but we really do value your responses because that helps us fill out or plan for subsequent events and give feedback to the speakers and panelists. So with that being said, thank you very, very much. I think we'll end there, but this is a conversation that continues. So thank you for continuing that conversation. Thanks, everyone.
Bye-bye. Thank you, everyone.
Thank you. Thank you, Megan and John. Much appreciated.
Take care, Teresa. Bye, everyone.
Bye.